Greetings everyone, welcome back to the channel. My name is Drew. I'm an exercise physiologist and Chinese medicine practitioner. And in this series of videos, we're looking at respiration, breathing, and core stability and how they're interrelated and linked together. And in this video, we're looking at transverse abdominis stabilization role. So how it kind of gives you the stability or the core stability in movement particularly, and how it interrelates to breathing. We are using the Muscle in Motion yoga app. You can find the link in the description below. I'm not affiliated with them. I just think it's a fantastic learning tool. We're in the asana section, we're in the theory section, and we're looking at core muscle function of the internal unit if you want to follow along at home. Now let me maximize this. So we have, get me out of the way. So here we're in a plank position and we have the transverse abdominis musculature. And just a quick little anatomy recap. Attaches on the lumbar spine, wraps around the side and attaches to the front on the linea alba. And it's deep, so it's underneath your rectus abdominis and your oblique muscles. And the key kind of thing here is you want to look at the line of the fibers and the direction they're going. So they're going horizontal, hence the word transverse. They're coming in that kind of transverse plane. And when they contract, they're going to be pulling everything kind of inwards like that. So that creates the bracing, kind of like a corset, if you will. And so what we want to do when we're trying to stabilize the spine is we want to activate the transverse abdominis to provide lumbar pelvic stability. So lumbopelvic, so the lumbar spine and the pelvis, they stabilize together. So I'll skip forward. So here we have an example of someone doing a plank. So here we have the kind of classic sagged back plank. So here either their technique is not good or they're coming up into like a cobbler type situation. But here we're looking more at just the sagging of the lower back. Here we have the opposite, which is the spine's in the extension or it's very lordotic. So here the lumbar spine and hip flexors are going to be very dominant in stabilizing the spine. Here what's happening is that you are still getting some lumbar extension, but if the glutes aren't engaged in this position, you're going to be kind of resting on the skeletal structure here, and that's going to put a lot of wear and tear into the lower back, which you don't want. And the abdominals here are in a lengthened position. So typically, unless you're well trained, muscles that are in a lengthened position are in a weak position. Here we have kind of the ideal position. We're in what we call a slightly hollowed out plank, or the pelvis will be in posterior tilt and the spine's in slight flexion. So think like you're doing a low sit up, but you're doing it in the plank position. Here the rib cage will be down, the abs will be on really strong, and the quads will be engaged. So here is a really functional position we want to get into here with training. Okay, this is really good. These two postures are quite poor, so we want to avoid these if we can. Let's skip through. So here we have another angle. We have the transverse abdominis fibers coming through here. So looking at the attaching onto the ribs all the way around, attaching onto the pelvis, attaching onto the ligament here. That's the inguinal ligament through there. So, and then this line up through the middle will be the linea alba. Underneath here, we have the pelvic floor, and then we have the diaphragm down here. And if we skip around to the side, you'll have the multifidi, which are those muscles that throw up and down the spine. So this is typically called the inner unit. So transverse abdominis, diaphragm, multifidi, and the pelvic floor together. So when these four muscles concentrically or eccentrically attract synergistically together, provides really good stabilization on the spine, the pelvis, and the thorax or the ribs. Keep that moving around. Okay. So when we take away the transverse abdominis wall, we can see here the diaphragm. So when you exhale, the diaphragm gets pushed upwards. When you inhale, the diaphragm gets pushed downwards, moves inferiorly. So all the internal organs here get pushed down this way, So the pelvic floor will be contracting eccentrically, going to kind of like create a bit more space to allow for all those internal organs to be pushed downward. So there's usually an opening sensation in the pelvic floor when you breathe in, okay? And then when you breathe out, that's when the pelvic floor contracts and the diaphragm domes back up. Now to do that with your core muscles, what you want to do is focus on the exhalation to pull the ribs down to help push the diaphragm up. So if we look here, keep going through. So here, that's exhalation, inhalation, exhalation, inhalation. So when you breathe in, the abdominal wall goes out, and it goes out because when the diaphragm contracts the dome down, and this it's not showing the diaphragm moving here, but it's going to push those abdominal contents downward. And so it has to go somewhere. And so you get a slight distension of the abdominal wall as you inhale. So in, that's exhale, inhale, exhale, inhale. So what we want to try to do is link our movement with our breathing pattern. So we're getting the right movement happening in the body, in the spine. So here we are in a 4-point kneeling position. So you're on your hands and knees. Good. And as you exhale there, the abdominals will draw in slightly. Okay. Now, as you inhale, the abdominal wall moves out. Inhale to exhale. So exhale, abs in. Inhale, abs out. Or it's not so much they're going out, it's as you breathe in, because the diaphragm's pushing down, it just pushes the abs out a little bit. And so it's typically very passive. So the muscles here are just kind of relaxing and opening. They could be concentrically contracting if you're consciously engaging your core as you're doing it. But typically in most positions, the abdominals going out will be fairly passive. Okay. But then as you exhale, same thing. It could be passive on the exhale if you're just allowing the diaphragm to dome back upwards. Okay, then the abdominal wall will naturally draw back in because there's a strong recoil action on the exhale. The central tendon is quite a big tendon, acts like a big rubber band, and it pulls the diaphragm back up. And plus, you've got a lot of kind of component of the lungs. There's a lot of elastic tissue in it to allow it to expand and then recontract to its resting position. So you have the kind of elastic recoil of the diaphragm and the lungs. But when you exhale with your abdominals, so here exhale and you contract your abdominals because they're attaching onto the rib, it's going to help pull the rib down and create that embracing engagement. Okay. Now, depending on who you're training with or how you're being taught, this is maybe a little bit exaggerated in terms of how far the abdominal wall's moving in. You want to create tension in the muscle. So when you squeeze a muscle, like if you make a fist and squeeze, you'll feel your forearm muscles firm up. So that's tension. So that's contracting of the muscle. You want that same kind of tension, that firming of the muscle in this region through here. So as you exhale, you just mind muscle connection and tension it up and squeeze it up. You don't necessarily have to like suck it in, because there is an issue there is if you suck this in all the way, you can keep the rib slightly elevated so you don't depress the ribs properly. And that can create some movement issues down the track. So if you're just talking about bracing in neutral spine, okay, what you want to do is draw these abdominals in and then also think about pulling this bottom rib down to get the really good stabilization on. Now, if you just suck in, but you don't pull the bottom rib down, what happens is that then the diaphragm gets stuck in that one position. And so that's going to restrict your respiration, your breathing in and your breathing out. So just be mindful of that. Now on the back, we have the thoracicolumbar fascia here. And as you tension the TVA, the transverse abdominis muscle, it's going to tension the thoracicolumbar fascia, and it's going to provide a lot of support in your lower back here. So as you tension the abdominals, you will see it there. We get this exhale tension, and it draws the lumbar fascia in a little bit, so that creates more structural integrity or tension in that fascia. Okay, and then when you inhale, it releases a little bit. So exhale, inhale, exhale, inhale. So typically what I recommend to people is the exhale is where you're really trying to engage the strong bracing position. The inhalation creates space because it's kind of like letting off the tension a little bit, and that's where you make any adjustments in your posture or your position. Now, the advanced training methods and techniques is that you maintain this brace through both the inhale and the exhale. So what you would do there is you go halfway. So you'd exhale about a halfway brace, keep that tension there. So you're going to keep that muscle engaged. Then these are slow twitch fibers, which mean they're designed for low intensity contractions, 2 out of 10 strength, 3 out of 10 strength, but over a long period of time, they're endurance based fibers. So you can kind of keep them contracted and on, and then that will give you space to still breathe in and out and still ventilate, move air in and out of the lungs as you're doing that. Okay. Versus like maximally contracting and really squeezing and drawing them in. So more advanced training when you're doing things like Pilates and martial arts or kettlebell training is you tension the core first. Okay, you find that brace, you maintain that brace, and then you still breathe in and out through your nose whilst you're doing your squats or your down dogs or your push-ups or your planks or your flutter kicks or your Pilates 100s or whatever the thing is, and you still got some stabilization on there. Because there's always a spectrum between if you go full lock, like full contraction, full lock, stabilize, that means that everything's really strong and stiff, but there's not much movement going to be allowed through those segments through that joint. So everything's got a trade-off. So if you're moving something that's really hard, really heavy, pushing a big load, and you want everything really strong and stable, then you do maximal engagement lock. Okay. If you need to be stable, but you're going to do some kind of rotation with it as well. So maybe you're doing like a single arm row and you want a little bit of rotation through torso, then you want a little bit of bracing to maintain alignment of posture, but you don't want to lock it out, because if you lock it out, then that turning has to come through somewhere. It might come through the upper back, it might come through your neck, it might come through your shoulder. The other joint will have to compensate and allow for that. So there's a little nuance to bracing and allowing some movement coming through. So the real advanced technique is you learn how to exhale and brace. So what you do here, you would breathe in, breathe out, brace, hold that, then little breath in, and then exhale, brace again, and that's your set position. Then you're ready. So in this position, you're doing bird dog, then keeping that brace on, keeping the shoulders aligned, you would lift this leg up behind you, engaging the hip, because when you lift this leg up, you're still going to have to come into slight anterior to allow the hip mechanics to work correctly. So you don't want to like fully lock it in, but there's a feeling to it. There's a sensation. You'll feel that stability coming through. Versus if you try to lift this leg up behind and this is not engaged, so if we can just come back a little bit to there, all right, then you're going to get a lot more excessive movement through this kind of pelvic region. And when you have that kind of excessive movement, then you're going to get energy leaks. You're going to get other muscles having to compensate. So if the core's not on, for example, here, you might stabilize more through your upper body, use your traps more to create more stability in the upper body. And so that way you can kind of get these energy leaks and energy transfers, and the body's just not as balanced. Yeah. That's thoracic spine. And just lastly, We put it into more advanced movements like a 3-point down dog. So lifting one leg up in the air, like you just don't care. So here we're in down dog, 3 points, so lifting one leg up. Okay. Breathing in, breathing out, stabilizing through here, breathing in, and then exhale, abs on. So what you do in this position is on the inhale, because the tension's let off a little bit, that gives the joints a bit more space. So you make any little technique corrections. So inhale, you might extend this leg up further. You might press the heel down here. You might try to like really stress into the palms and stabilize the shoulder. You might create a little bit more extension through the spine, because when you breathe in, it's more extension. So give more space. And then as you exhale, you brace and hold. And then when you're in the position, in the posture that you're happy with, you hold that there. So you keep this engagement on in the core and you breathe through the center, okay? But don't let this tension go on the core. Now, because you're in this 3-leg dog position, the pelvis is going to want to rotate, and it's really normal. So if you inhale and really extend through the leg, that's going to create this kind of slight torque. And so you'll get a bit of rotation, but it will be controlled if you're bracing correctly. And then you exhale and brace and really put the brace on. Okay. Or you can be really super strict and try to keep everything lined up and then stretch the leg out and not moving the pelvis and then letting it rotate. So it depends how strict you want to get it. Personally, I like a bit of movement, because when you breathe in, the spine's going to move into extension. The pelvis is going to move into an anterior tilt. That's going to change the orientation of the femurs. And so there's naturally going to be a little bit of a rotation through the femur, through the leg. And you want to kind of move with that, to breathe with that movement. So once you understand how to use your core and how to brace, all the movements are basically the same. Doesn't matter if you're doing yoga or Pilates or strength training or kettlebell training, the techniques are all the same. Okay. So for example, at the moment I'm doing Yi Jing Jing muscle tendon training, Qigong. It's more of advanced Qigong training. And a part of the training, we do a lot of bracing work with breathing, bracing your core, bracing your pelvic floor, okay, like in horse stance. So getting down into your horse stance, holding horse stance, and then doing a lot of kind of like arm movements. And then you're syncing that up and you're exhaling and bracing, being really strong contractions, but you're keeping the brace on while you're doing your horse stance movements. Okay. It's quite strong, it's quite challenging, but once you do it, and it really helps to kind of reinforce how to do the breathing techniques correctly. And you get it because you can get into a horse stance and you feel really strong, like quite strong. And then when you integrate a horse stance with your inner thigh muscles, your adductors, then you're really powerful. And you can see the benefit of practicing horse stance. But if you don't know how to brace and how to orientate your pelvis, you can really hurt yourself, which I've done in the past, because teachers have not known how to actually instruct it. And for whatever reason, got poor instruction, and or I misunderstood, and I trained incorrect techniques, created an injury in myself. So through trial and error, we do learn. But part of my mission here is to help people skip the error phase and go straight into the doing it well phase. Okay. Thank you very much, everyone. I hope you enjoyed that. A quick little review on transverse abdominus bracing. Definitely feel free to grab the Muscle in Motion app. It's fantastic, as you can see. We're just scratching the surface of the app there. Go along and support the company. If you have any questions, feel free to drop me a line, ask me in the comments below, ask any questions that you do. I love it when you guys ask me questions, and we'll see you in the next video. Keep studying, keep learning, stay humble, and keep training. Ciao.